Now, it's been almost 3 years since the Ebola epidemic broke out in West Africa. It killed more than 11,000 people and really laid bare the weaknesses of the public's health systems, the region's public health systems. No new Ebola cases have been reported since March, but the 3 most affected countries remain on alert. VOA traveled along the path of the outbreak to find out what has changed and how the region might cope if Ebola broke out there again. Ricci Shryock has this report from southeastern Guinea, where the epidemic first began.
We're deep in Guinea's Jeke forest.
When someone is bit by a snake, this is what we treat them with, and it quickly goes away. The forest is a pharmacy.
People pay healers what they can. Many here can't afford clinics and prescription medicine.
We came here because my father here is sick. It's cheaper than hospitals. They haven't even asked us for any money yet. They treat him first.
There are only 30 medical doctors in this part of rural Guinea, but there are more than 6,000 traditional healers.
We are the intermediaries between the modern doctors and the sick. We treat those we can, and we send those we cannot to the hospitals.
It was here in the forests of southeastern Guinea that the regional Ebola epidemic began in late 2013. Traditional healers found themselves on the front lines, facing a deadly foe they had never seen before. Many healers contracted Ebola while treating patients. Ebola looked like other common illnesses at first, and they didn't know how it was transmitted, via bodily fluids. If Ebola reemerges, experts say the first cases would likely land on a healer's doorstep. What happens next may be critical. The World Health Organization and other partners have trained hundreds of traditional healers in Guinea on infection protection and control.
It's about cleanliness. We need to wash our hands. We need to use chlorine. All this for cleanliness and to help people who need us.
But Niami has run out of the gloves and other protective equipment he got as part of his training in April. He said his requests for more have gone unanswered. Regional health officials said they aren't aware of shortages.
They're always served by me. But if I'm not asked and not informed, if they say they asked their focal point, that person doesn't manage the chlorine. It is the logistics unit and they pass by me.
Bureaucracy aside, Niami says the epidemic taught the healers they can't cure everything, that some cases have to be referred to clinics. But Niami adds one thing hasn't changed. His door will always be open to patients in need. Ricci Shryock for VOA News in Zerikore, Guinea.